Topic today is caring for the teeth and gums of your loved one with Alzheimer's and dementia. The audience that I would present this to are primary caregivers, nurses, CMAs, CNAs, and also primary caregivers such as friends or family. The objective here is providing education on how to care for the teeth and gums for a person with Alzheimer's and dementia. Dementia.betterlivingwith.com says it's important to keep the mouth clean because painful gum infections and tooth decay can occur. They also say that toothaches can cause people with dementia to go off their food and become restless and easily irritated. I completely agree with both of those statements. The materials we're going to need today are a toothbrush, toothpaste, sink or basin, towels or other means to protect clothing items, and, of course, patience. Here's the procedure. Step 1. Explain what you hope to accomplish before beginning to brush. Show all of the supplies that you'll be using. Place your towel over your shirt to protect from splatter. The next thing you'll do is begin brushing at the gum line using a jiggle jiggle sweep motion that sweeps the tooth germs towards the tongue. Next step is repeat the jiggle jiggle sweeping on the other half of the mouth, and don't forget to brush the tongue. Allow for sips of water, wipe face, and clean up supplies, removing soiled towel and make sure shirt is still tidy. And then thank your participant for allowing you to brush their teeth. I think it's really important to remember that this is a human. We work on humans. We do not work on airplane parts or in a factory. Things to consider. When you're brushing the teeth and taking care of the mouth of someone with Alzheimer's and dementia, it can be very scary to have someone in your personal space. Do not fight if the teeth cannot be brushed. Just try again another day. Try to make a good choice about what time of day is best for brushing the teeth. What time did the person typically brush their teeth? Was it in the morning? Was it in the afternoon? Do they like to take their coffee first or eat their breakfast first? It's important to keep a normal routine. Not that it should impede the caregiver's ability, but at the end of the day, it's what is best for the patient. Allow as much autonomy as you can. If your person can brush their own teeth, let them, and then go back in and hit the hot spots. I don't want to say think of it as a toddler because that's not fair. They deserve more dignity than that, but also think of it like a little kid. You want them to be independent. You want them to have freedom, but you know they need more help than they can give themselves. That's it. That's basically it. Also, with arthritis in the hands and wrist, it might be hard for your person to even get that toothbrush in their mouth. Be thoughtful of that. Try to relax and come to this task in a good mindset to let the person know that it is okay to allow you to brush their teeth. I think a lot of times it's easy to psych yourself out when you're thinking about a task you dread or thinking about how much maybe you wouldn't want to be in that position or you wouldn't want someone brushing your teeth. I think it's best just to remember that this is for the best. Alzheimer's.org also suggests trying different toothbrushes, such as a long-handled toothbrush, and to be aware that an electric toothbrush might be confusing. Also, maybe consider a proxy brush instead of floss. And a proxy brush is like a little Christmas tree brush. You could put that between the teeth. You never want to force that tool. Anywhere where that space you can get in there and clean that space, that's the right answer. Going back to that electric toothbrush might be confusing. Sometimes people have been using a manual toothbrush their whole life and it didn't occur to them, or they've forgotten that kind of technology exists. So it can be scary, even though that big, thick handle might be what you need for them to hold it as far as arthritis goes. I think it's okay to use those electric toothbrush just as their manual to kind of give you assistance, give them assistance. Really, it's about meeting people where they are. It's about getting creative. It's about thinking outside the box. Caregiver.org says dental hygiene is important for overall health. Poor dental hygiene may lead to heart disease, gingivitis, stroke, osteoporosis, and respiratory disease. In addition to causing bad breath, inadequate dental hygiene can affect the ability to eat, chew, and talk. It goes back to food is important. You have to eat to stay alive, and if it hurts to eat, you don't want to do it. Finally, never shame the person you are helping. Don't scold, don't smack, don't get frustrated if you can. If you feel yourself getting frustrated, this is definitely a walk away task. Because while it is so important to get these things done, it is not worth World War III. It is not worth a setback in their daily demeanor. It is meet people where they are. Thank you so much, and I appreciate your time.